All right, good morning, everybody. We're so excited that you're here. We have people in front, we have people in the back, and we have these special banners. And it's a big day for us. I hope we all remember this day for the next 5, 10 years. It is a transformative day. It is a day that we're going to remember as when this new Baton Rouge General relationship with our physicians has started. Today, we're thrilled to announce that the Baton Rouge General, our Baton Rouge General group, the Baton Rouge General physicians, together with the Baton Rouge Clinic, are joining the Mayo Clinic Care Network. You know, the theme is working together. And through this relationship, we will work closely with the #1 most respected and recognized healthcare system in the world, the esteemed Mayo Clinic. I'm joined in this important announcement by members of our boards, physicians, staff, our friends at the Mayo Clinic, including the Medical Director of the Mayo Clinic Care Network, Dr. Weedy. We will be the first healthcare organization in Louisiana to join the network, and we believe it is one of the most clinically meaningful steps that we have taken toward providing high-quality patient care. For more than 100 years, the Baton Rouge General has achieved some amazing things, all with collaboration. And that's a theme not only of today's announcement, but for our entire relationship with the Mayo Clinic, collaboration. Our success in clinical quality and patient safety and experience is due to the extraordinary collaboration of our physicians, our management, our board, our 3,500 staff members, and our volunteers. And that collaboration and its achievements is truly something to celebrate. So with that, I'd like to welcome Baton Rouge Clinic's CEO, Ed Silvey, to say a few words.
Thank you, Edgardo. Good morning. And as Edgardo said, we are very excited to share this news today, which we have been working on for a pretty good while. When our 4 founding fathers started the Baton Rouge Clinic in 1946, they were ahead of their time. The idea of a group practice was way ahead of its time and not heard of at that particular point in time. But they understood one thing, and that is the value of physicians working together to improve patient care. And today, we continue to build upon that belief as we join the Mayo Clinic Care Network with the Baton Rouge General. In addition to collaboration, pride in our community has been a cornerstone of our commitment to quality patient care. We believe that each person in every corner of our community deserves access to the best patient care available. Our relationship with Mayo Clinic solidifies that dedication and gives our physician more tools and resources, all Mayo backed, to treat patients where they belong, close to home. Now please help me welcome Baton Rouge Clinic's Dr. Joel Silverberg and Dr. Louis Minsky with the Baton Rouge General to say a few words.
Thank you, Edgardo and Ed. We appreciate your leadership and vision. I'm happy to be here to celebrate the relationship, this opportunity for the advancement of medical care here in Baton Rouge. In the early 1900s, a train derailment in downtown Baton Rouge injured several railroad workers. Dr. T.P. Singletary, a Baton Rouge physician, took them to a nearby building and treated their injuries. In that era, most healthcare took place in a patient's home. But Dr. Singletary knew there had to be a better way, that he and other physicians could treat patients better if they were all in one location. That was the beginning of the Baton Rouge General. And his values and passion to provide the highest quality care still ring true today. As we began to explore the potential for collaboration with Mayo, it became clear that our values, both at the hospital and in our clinics, were remarkably similar. Mayo Clinic has a stellar reputation, more than 150 years of commitment to patient-centered care. And now we will be offering access to world-class expertise and the best care right here in Baton Rouge.
Thank you, Louis. When the idea of joining the Mayo Clinic Care Network was brought to the leadership of the Baton Rouge Clinic and here at the Baton Rouge General, we of course asked why. And the why is easy. We share missions of outstanding patient care, as you've heard, and trying to maintain an outstanding patient experiences. And there's no better collaborator than the Mayo Clinic at maintaining our vision and our goals. We already think we provide superior patient care here in Baton Rouge. We're continuing to strive to improve. Mayo's continually strives to improve, and together we think we're going to make care for our community and our region better. It's my pleasure now to welcome Dr. Ryan Weedy, who's the medical director of the Mayo Clinic Care Network, to share some thoughts about our collaboration. Dr. Weedy.
Thank you very much, Joel. It's a real honor to be here. On behalf of Mayo Clinic and my colleagues from Mayo Clinic at a number of our destination campuses, we are just thrilled to be here to celebrate and welcome Baton Rouge General and the Baton Rouge Clinic to the Mayo Clinic Care Network. I want to say just a few brief words about the Mayo Clinic and the Mayo Clinic Care Network. Mayo Clinic has a 150-year history of physicians working together. Our founding fathers, the Mayo brothers, developed the first multi-specialty group practice. In addition to bringing teams of physicians with different expertise, all brought to bear on patients when they needed that help, they made disciplined investments in education and research, R&D. That R&D has fueled improvement in the care that we can provide. 150 years later, we have 4,900 physicians at Mayo Clinic located at our campuses in Rochester, Minnesota, in Jacksonville, Florida, and Phoenix, Arizona. Together with our entire team, we deliver care to 1.5 million patients each year. We also train more specialists than any institution in the country and invest $1 billion in research each year. Now, as we have developed over those years, we have had one guiding principle, and that principle has been the needs of the patient come first. That has governed all of our decisions. Now, as we have gotten to this day, and it's been a number of months in the works, our team has reviewed what really happens here at Baton Rouge General and Baton Rouge Clinic. We had a due diligence team that was on site, and what we found was that same commitment to patients and this community that we have enjoyed at Mayo Clinic. That alignment is extremely important from our perspective. And as a result, we saw your commitment in action, and we saw why these institutions are so highly rated in terms of quality for the patients and this community. As a result, we are very excited to have you join the Mayo Clinic Care Network, which is now made up of 47 institutions spanning the entire country from Florida to Alaska, as well as 9 international sites. We all are sharing in the knowledge and experience not only that Mayo has gained over the years, but also the experience from each of our Care Network sites. What does this mean for patients in this community? What it means is your patients will continue to receive the outstanding care from Baton Rouge General and Baton Rouge Clinic. The physicians and your teams at those institutions have Mayo Clinic as their partner as well. So we're very, very pleased to be part of this new journey, and we look forward to working together to serve your patients. Thank you.